Hi. All right, I want to consult with her first. Is this
I think if you got up to 8 minutes or something.
So, I had to confer with him because I know you get in big trouble here if you use more than your allotted time. So I didn't want to get in trouble. I wanted to have Barry always inviting me to meetings and not saying, I hope she doesn't come. So, I am, as you know, running for Senate District 32, and this is my first time on a ballot, which is pretty exciting. And here's the embarrassing part, I didn't even know I was going to be on the primary ballot. I called Aaron up and said, am I on the primary ballot? Because I didn't realize that even though the convention people had dominated me, that it still needs to go through a ballot thing. So, and Owen is my campaign manager, so Owen is the numbers guy. I don't know numbers that well. Owen sometimes tells me that even if I were to go on vacation and come back the day after election, I would be elected because I'm blessed to live in Denver. And what I like to say to, he's saying that to say, you know, don't stress yourself out to the point where you're not sleeping at night. And I always follow that with, well, as long as people don't meet my husband. But we are trying to do some walking. Yeah, there's so much to do, and as some of you know, I went and spent 3 weeks at the Harvard Kennedy School of Government, learning about how to be a better state and elected official. And one of the things they really emphasized was you really can't do it all. You really need to try and focus. And so Owen, being the pushy guy that he is, emailed me and said, you told me what your 3 priorities was. Where did the elections fit into that? So part of what for me is important with the election is, first of all, I don't know about you, but I'm really concerned about the hatred in our national election. I read yesterday the editorials in the Denver Post, and they were just so ugly. You know, it was just so ugly. And I don't know, I don't have any contact with the Obama campaign, but we need to figure out how can we turn this around, because when I walk, that's what I hear. Oh, they're so mean to each other, it's so ugly, they're all bad. You know, and it's not, I don't think it's working. Whatever this is we're doing isn't energizing people to vote. It's making them really discouraged. Turned off. And turned off. And I think in an election like this, because my stereotype perception, and maybe the data's there and I've heard it, and that's why I think this is that Republicans are better at voting than Democrats are, that it's really important that we not turn people off and that we get people engaged and interested in coming in any way that we can. The other thing that's interesting about the populace is it seems like things that are hot button issues today are gone the next day. You know, it's not like there's any one thing other than jobs and the economy that people keep bringing back. In any polls you do, it always comes back to jobs and the economy. And I think that's interesting because for me that's an incredibly complex topic. And when I think about jobs and the economy as a Democrat, what I think about is that part of the problem for me with the recession is that as there are fewer and fewer jobs, people who are less skilled, it's like a race for the bottom. You know, people who have big businesses, have a lot of jobs they can offer, what they're looking at is how low can I go before nobody will take this spot? And then people who really are worried about, can I pay my rent next month? Can I pay my bills? Am I going to be able to feed my family? Are willing to take anything. And so I see this huge backlash against the unions that's out there because the unions are expensive. And to me, what the unions are what allowed us to have a middle class. Because the difference between $7.25 an hour with benefits and retirement and $7.25 an hour with nothing is huge. Benefits and retirement probably double the value of that $7.25 an hour. And so, you know, when people say things like, oh, people on welfare, they don't want to get out there and get a job, all I can think is, you know, if somebody paid you $7.25 an hour and always said you weren't working fast enough or hard enough, and that's all you got for it, and then as soon as you took that job, you lost your Medicaid, you lost your child care help, you lost your ability to get food stamps. I mean, that would be a hard sell for me, and I have a good work ethic. everybody should have a great education and have a better paying job, but there are a lot of people that are grown now, and they're not there, and I don't know how we help them get there, but I think we all need these workers who do those menial tasks. I do not want to work in McDonald's, but, okay, I don't like going to McDonald's, it's not a good example. I don't like working, I say, but I like to go there and get food, but I don't really like to go to McDonald's. But you know what I mean. There are all those places, all those things you do, and there are workers doing those jobs, and they're very important. Or even in the hospital, frankly. We need people to clean up the blood, we need people to clean up the messes, and those are not very high-paying jobs. Fortunately, most of the jobs in the hospitals come with benefits, so at least you get that. But I'm just wanting people to think about that as you think it through, because when I think about how do I fix this economy, what's so concerning for me is the way you need to fix it is that you need people to be less greedy. Because really what you need to say is, it's okay for me to make only $1 million and use that second million to be sure that those workers under me have access to health care and access to retirement and paid sick days and vacation days so they can have pride in their work. And they'll give me more than I pay them for because they'll be grateful to be there. So I didn't mean to get up here, maybe it's the church setting that did that. But that's how I think about these issues. It's really hard for me, and I don't know the answer. If somebody knows the answer, please give it to me. We had these law student interns working with us last year, and I said to them all, and if you come up with a great idea for fixing the economy, let me know. I'm happy to run it. And before I forget, West Wash Park, I was at one of their neighborhood meetings, and they're doing a house tour September 15th. I'll leave these here for anyone who would like to go. And then any of you who like to read nerd political policy books, this was recommended to me by one of the professors at Harvard Kennedy School. It's called The Art of Political Manipulation. And it talks about how you basically maneuver things to get the outcome that you want. And I've read 3 chapters. It's a little bit over my head, so if anyone reads it, we could do a book club on it, so I could try to understand all the concepts in it. But I've read it, and it was interesting because I could see things there that were happening now, that were illustrated in this book, and I could see them happening, and I thought that was really interesting. And so, as you know, the number one thing on my AAA or what I want to do list is change healthcare, and so Gary had asked me if I talked to you a little bit about healthcare. And I'm glad that some of the fervor has died down since the Supreme Court decision, because the reality is for most people, the Affordable Care Act doesn't make a difference in their lives, because in Colorado about 57% of us get our health insurance through our employer. And the employer health insurance process is not necessarily going to change in the short run, with the exception that they're going to be things that you can benefit from, like that your kids can be on your plan until you're 26, and that the companies will have to spend 80 to 85% of the premium on healthcare. Imagine that. You give them money for healthcare, and you're going to force them to spend it on healthcare. And then, and actually, the insurers are no longer going to be allowed. Right now, they can't have annual limits, but in the future, they won't be able to have lifetime limits either on coverage. And now the best thing I think for many people is if you change a job after 2014, you don't have to worry that you'll be uninsurable. There really are people who work in certain jobs just because that's the only place they can get access to health insurance. They call that job lock. And you know, Colorado is known as being a small business state, and people like to start their own small business. But if you have a pre-existing condition and you need insurance, you can't start a small business because nobody will insure you. So after 2014, that will change. And that's a big plus. And the other thing about that, and I just have to tell you this because you guys understand, and I love it when people understand these concepts, which is that the state of Colorado has, we do have high insurance costs for our employees. Colorado Wins is the union, and people blame that on the union. It's not the union's fault. The reason we have high insurance costs is that people with chronic diseases know to work for the city or the state or a big company because then they'll have insurance. So we have a high-risk pool in our insurance group as a state employer, and that's why our policies are expensive. You know, if you're a young, single, healthy person, you could probably buy an individual policy cheaper than you can get working for the state. But that's because then they're insuring all young, healthy, single people. But in the state, we really cover everybody, and so our insurance is, relatively speaking, expensive. And so now, I just mentioned that so that you know why it is the state pays so much for insurance. It's because we do have a lot of people with illness who choose to work in big companies and be hidden. So the people who get helped by the Affordable Care Act, in my mind, are the 16% of our population who currently don't have insurance. And one way in which they can be helped is something that we're going to have to step forward as a state and decide that we're going to do, which is to expand Medicaid. But the affordable, what the Supreme Court said was, the Affordable Care Act said everybody goes to Medicaid at 133% of federal poverty level. And the Supreme Court said you can't force the states to do that. States have to decide on their own whether or not they want to do that. And they're very radical, conservative governors who've written literally nasty letters to the Secretary of Health and Human Services saying, I'm not going to take your Medicaid money, you can't make me now. And you know what I'm not going to take your Medicaid money means? It means I'm not going to let people who live in poverty have access to health care. Because what this is going to do would be to allow people who live at under an income of about $12,000 for an individual, $20,000 for a family of 4, to automatically qualify for Medicaid. And in the state of Colorado, we had already said we were going to try and cover people up to 100%. So everybody thinks we'll definitely do that. The 100 to 133%, people who are playing politics, don't want to talk about what will happen with that. Since Mark and Pat are gone, I've already put in a bill title to expand Medicaid to 133% in the state of Colorado. And I've already been meeting with the Colorado Hospital Association, who's a traditionally Republican lobbyer, because they want this to happen. And I'm going to be meeting with COPIC, the malpractice insurer, because I think they want this to happen. And my thought is I'm going to get Republican lobby money people to also say they want this to happen, so it happens no matter what. And if I don't have to run a bill because the governor will just do it, Lord bless him, but I want it, they're ready and we'll do it. And so assuming we have a Democratic House and Senate, we'll have Medicaid at 133%. So for our expansion in our state, the first thing will be for the 16% Medicaid to 133%. The next thing will be that people who couldn't get insurance because of pre-existing conditions, now they'll be able to go to the exchange, which we are moving forward with, and we'll be able to buy a product. Right now, the exchange has said we're going to keep our risk pools for the individual market separate from our risk pool for the small businesses, and that's like a 3-hour lecture of why they made that choice. But I can tell you that if you care about everybody, that's a bad choice. But anyway, they made that choice, but still that means that people in those groups will be able to get a policy no matter if they have pre-existing conditions or not. And if they earn under 400% of federal poverty level, which is about $20,000 for an individual, and $88,000 for a family of 4, they'll be eligible for a tax break, not a tax increase actually. And what it'll be is that the government will pay part of your premium for the insurance plan that you pay. And they'll pay that directly to the insurer. And so that's a huge help for those people. Most of the people in Colorado without insurance don't have it because they can't afford it. So now we're going to be giving them money to purchase insurance with. And that will happen with the rest. Unfortunately, we'll still be left with about 400,000 people without health insurance in our state. We'll go from 830,000 to 400,000. About a third of those will be undocumented. And the undocumented, that's like such a hot button issue, nobody's talking about them. A third of them will be people who, even with the subsidies, it's going to be too expensive for them to purchase insurance. And so they won't have to pay a penalty, but they won't have health insurance. And then the last third will be people who, are like those governors who wrote the letters to say, just make me pay the penalty, I'm not going to buy this policy, you can't make me. And so that's about what we'll be left with at the end of this in Colorado.
Middleburg's going to be the emergency room people again.
Yeah.
We're going to continue on with those people.
We'll continue to subsidize people in the emergency room. As you all know, I really want our state to change the way we play this game and cover everybody right from the start. And so I will be introducing a bill that would say if this bill passes, it will be referred to the people for a vote to do a universal health care system in our state. In order for a referendum to pass, you need 2/3 in the House, 2/3 in the Senate, and the governor's signature, so I don't necessarily expect that to pass. But one thing I think we don't do enough is to push the limit and say, look, we're doing this, we're going to do Medicaid to 138, and I'll tell you some other ideas I have, but that isn't the answer. This is the answer. And so if you give me this, I'm compromising, because this is what I want. Because I don't want people somehow to think that by doing these little things, they've solved the problem. I want them to recognize there's a bigger problem that we really need to solve. And then the other thing I'm looking at, okay, this guy's on here. I'm going to actually have a meeting set up with Colorado Hospital Association and Colorado Medical Society pretty soon. and Rocky Mountain Health Plans. You know, Rocky Mountain Health Plans is our plan on the western slope that T.R. Reid highlighted in that movie, Healthcare, the good things that are happening. One of the things that Rocky Mountain Health Plan does is that they collect all the insurance premiums from everybody, Medicaid, Medicare, whatever your company is. They put it all in one pool, and they pay the doctor the same no matter who they see. So a doctor doesn't have a disincentive to see a Medicaid patient or a Medicare patient or a Wells Fargo patient versus a Denver Health patient. They're all the same to the doctor and provider and the system. And then they pay the doctor about 80% up front, and the last 20% they get bonused on based on their performance. And so Rocky Mountain Health Plan has, like, everybody comes to study it because they have the best health outcomes and the lowest costs in the nation. So one of the things that I'm doing on the Rocky Mountain Health Plans is what I want to do is see whether we could write a law requiring that all insurers in Colorado have a Medicaid product. Because one thing people worry about is that people get on Medicaid and then they get a job, so they lose their Medicaid, but then they lose their job, so they're back on Medicaid. They call that churn in and out of the system. And every time you switch insurance, those of you who've had to do this know, you end up with different doctors and a different system, and it leads to some cost increase and bad care for the person. So the goal here would be that if everybody has a Medicaid product, you could just stay with the same system whether you're on Medicaid or not. And so I think the Hospital Association and Rocky Mountain Health Plans are okay with this idea. The other insurers will probably hate it, but I think if I can get them and CMS and COPIC on board, that gives me the block that I need to push this agenda forward. And that moves us toward going closer to what a single payer system would be like, where everybody looks the same. So that's what I'm planning to do.
Hey, well, thank you very much. Irene is going to talk about that. But you got to understand, in 2 years, she's learned how to play this system well. 134, you did the same thing. She could have come out of committee. She had the votes. But she wanted the big players on her side. And she said to Betty Boyd, don't take the vote now. Let me talk to them. And we got that through.
You came out unanimous, DNR.
So she can work across the aisle to if she gets the chance to strategize and do that. And we need her, and we need to listen to her because she has some great ideas. She had them even before she was a legislator because she did an awful lot with Healthcare for All Colorado. And Insurance 101 is spread the risk, and these separate pools just are contrary to common sense.
Yeah.
Thank you very much.
And thanks to all of you who have walked with me. I really appreciate it. As Owen knows, it's really hard for me to walk because I feel like I'm just knocking on somebody's door, and in spite of what Mark said about, get a nice hello, you don't always get a nice hello. You're marking on people who've been inactive. And they're really pretty hostile toward our candidate electoral system. And all I can think about are the people who die every day in Syria for this opportunity, and how we just take this so much for granted, and how can we get people to recognize what a gift this is and try and use it again. So I'm off to the Latino Initiative.
Thank you, Gary. Next on the agenda, we have